The number of Utahns dying from opioid overdoses went up during the pandemic. In tonight's Your Life, Your Health, Intermountain Healthcare wants to spread the word about a drug that can save lives if you have it on hand.
I've got it at home. I've got it in the car.
This life-saving tool can fit in your pocket.
Carrying it wherever you go is not hard. And naloxone.
Dennis Shakini is ready to use it at any time, even while walking the dogs.
And in this pack, you've got the water, and in this side, I have my naloxone pack.
A drug that reverses an overdose in an instant. Naloxone comes in a nasal spray or a syringe. Overdose deaths from opioids climbed in the pandemic, so medical workers want more Utahns to keep the drug on hand, even if you don't think you're at risk.
It could happen to anybody.
Kim Compani works in pain management with Intermountain Healthcare. She says you don't have to be addicted to overdose. Certain medical conditions or even alcohol can increase the risk.
We're all susceptible to an overdose, even when taking the medication just as prescribed.
She says to think of naloxone like a fire extinguisher or an EpiPen for severe allergies.
I just keep it in
Another
here.
Tool in your emergency kit. Compani says it's important to have it on hand, even if you're only taking pain pills for just a few days after surgery or an injury.
Naloxone is a godsend. Well, you're looking at Tennyson's coffin.
Shakini says it could have saved his son Tennyson, who used heroin to cope with childhood abuse before he overdosed in 2015.
My wife and I had to watch our son die.
They didn't know about naloxone at the time.
Don't want to do that again. Don't want anybody else to have to do that again.
The same dose can be used on children, adults, no matter the age.
Compani says there's no downside to carrying and using the medication.
And that's the great thing about naloxone.
Heroin and pills, it all kills. Naloxone saves. That's the point.
The price you'll pay for naloxone at a pharmacy varies widely depending on your insurance. But Komani said Intermountain is working with insurers to lower the cost. In the meantime, community groups like Utah Naloxone provide it for free.